During your time as a student at the Bridge Valley Clinic, you will be required to complete a series of technique evaluations, one being the patient communication and informed consent technique evaluation. Contrary to popular belief, this is something that you need to complete with every patient. It is not just for your informed consent technique evaluation. I will be giving you an example of me giving an informed consent to a patient with moderate gingivitis. Hopefully this will help you to be able to understand what exactly an informed consent entails and give you some tips and tricks that you can utilize when you are relaying this important information to your patient. Thank you for coming into the clinic today. I appreciate your time and for allowing me to broaden my knowledge while treating you. During your appointment, I completed a thorough evaluation to assess your current oral state. During this examination, I completed a series of tasks that allowed me to gain vital information that is necessary to form a treatment plan tailored to your individual needs. Using the acquired information from today's evaluation, I have concluded that you exhibit signs of moderate gingivitis. Upon arriving today, you completed a medical history which showed you had no significant systemic issues, were taking no medications, your vital signs were normal, and you state that you visit a dentist at least once a year. Your oral cancer screening indicated no significant findings. We completed a dental examination, which is the inspection of the teeth, and the breakdown of enamel, which is the outer layer of your tooth. This showed no significant findings, as well as a periodontal assessment, which is the examination of the gums and surrounding bone, indicating healthy bone levels, but a severe infection of gum tissue around the neck of the tooth called gingivitis. This is caused by bacteria plaque accumulating and not being removed with a brush, floss, or some other cleaning device in between the teeth. I have developed a treatment plan based upon the examination, which includes the following: 4 radiographic images to check in between the teeth for the breakdown of enamel and to evaluate the health of your bone, an education session evaluating your technique in removing the bacteria and offering areas for improvement and suggestions for that, a thorough removal of the bacteria and deposits on the teeth above and below the gum line with my dental hygiene instruments, and a fluoride varnish application to help strengthen the enamel of the teeth. This will require 2 appointments today and 1 additional appointment that we will schedule together. Failure to address the gum infection you presented with today could lead to infection progressing into supporting bone surrounding teeth and eventually causing periodontal disease and tooth loss. I have a visual aid to show the progression of this disease, beginning with healthy bone and gums, going on to gingivitis, all the way up into advanced periodontal disease. Fortunately, gingivitis is reversible, and if we work together to complete this treatment, we can see an improvement in your overall health, not just your oral health. But if you do not complete this treatment, the disease will progress. Bacteria causing the gum infection can enter into the bloodstream, causing inflammation in other parts of the body and contribute to other conditions like diabetes and heart disease. There is minimal discomfort with this treatment. We can work together with that. It is all based upon your pain tolerance. We can go through the appointment just as planned, and there's always the option for local and topical anesthetic. There is also no cost to this treatment. The only thing that we ask for is your time. Benefits of bacterial removal today and you effectively removing the bacteria on a daily basis is healthy gum tissue with no bleeding, reducing your risk of gum infection and infection of the surrounding bone. Plus, the fluoride will strengthen the enamel and the improved home care will reduce the risk of developing tooth decay. Do you have any questions that I can answer for you? Do you agree to this treatment? Would you please read the information and sign where my instructor and I have signed? This is an agreement between the 3 of us. We will all fulfill our responsibilities, ours being to provide these services to the best of our ability, and your responsibility being to present for appointments as promised and attempt to follow instructions provided to you to the best of your ability.